Du nouveau à Minneapolis, Tempo Afrique Travel. Vous voulez voyager? Achetez vos billets d'avion à l'agent de voyage Tempo Afrique Travel. Avec l'agent de voyage Tempo Afrique Travel, pas de problème de connexion, pas de problème de transfert de vol. Avec l'agent de voyage Tempo Afrique Travel, c'est le voyage en toute tranquillité, en toute beauté, de votre maison jusqu'à votre destination. Votre satisfaction est notre plaisir.
Votre attention s'il vous plaît. IPTV Services. Tempo Afrique TV vous offre 6000 chaînes de télévision en direct de l'Afrique, de l'Europe et des États-Unis. Toutes vos chaînes de télévision préférées sous un seul toit. Pour des informations, appelez le numéro suivant +1 612 804 02 95 ou allez sur notre site web tempoafrique.com. Achetez maintenant $193 pour toute l'année, plus l'expédition et le TV Box.
Good afternoon or good evening, depending on where you are on the globe. This is Tempo Afrique TV, the Pan-African television for Africans by Africans. You are on this show called What's Up Africa. You familiar with it? What's Up Africa, que fait l'Afrique, promotes Africa, promotes brilliant people, geniuses from Africa, of people of African descent, who are changing the world because of their not activism, but their brains. They're changing the world, literally. And we're proud of our youth. Africa by 2030, 2063 will be the youngest continent on the face of the earth. And youth is the future. They are the future. And today it's APIVIRINE and ApiQuest USA, proving the universality of science. And nobody else than these two young men can really talk about this issue and help you better understand where they're coming from and where we are today. Since the 2020 pandemic that has transformed the world positively, negatively, I don't know, but they will tell you. Ladies and gentlemen, welcome Mr. Travis Kendrick. Good afternoon.
Good afternoon, Desiree.
And Dan Sarr. Good afternoon.
Good afternoon, Dr. Elby.
Your CV, it's just too long. I tried to summarize, and then I couldn't. So let's hear it from the horse's mouth, as they say. And we'll start with Dan Sarr. Who are you? Who is Dan Sarr?
Okay, you just captured my Skype name. My name is Mike Saray, and I have been working with ApiQuest USA for the last couple of years. But prior to that, obviously, I have worked intensively after graduating from Howard to connect USA to Africa in business mainly, but also in education, and now, as you can see, in healthcare. I have joined very quickly the leadership, African-American leadership here in the United States through the youth that you mentioned earlier in your introduction, and traveled extensively to Africa with youth groups, mainly being mentored by the Reverend Sullivan. Reverend Sullivan is one mentor, one leader, one seer who back in the early 80s decided out of his Philadelphia church to awaken young people to reconnect with the continent and to revive our communities and to show the pride of who we are. And therefore, he had created his youth groups across American universities, and from Howard University, I was able to lead the first group of African Americans to young people of African American descent to Senegal, Dakar, Senegal, where we first had our African American conference with Reverend Sullivan in 1995. The prior one was first done in Abidjan, Cote d'Ivoire. But following that, the second one obviously happened in Senegal then, and we had a chance to reconnect with the leadership here in the United States and follow up with bigger and bigger connections, which is joining in the development of Africa, U.S.-Africa relations. And I want to name AGOA. Dr. Balobi, you know AGOA very well.
Yeah.
You know how it started. And I was one of the people that were contacted then back in early 1999 to join the White House led by Mrs. Whitaker to critique and to have an input in what it is that AGOA could do for Africa. Since then, not a lot has been done, actually, because Africans, as you mentioned again, did not have a chance to make that connection and take advantage of what it is that U.S.-Africa relations would do. And so I remain on that mantra up till now, as you can see, until I discovered the like of Travis, who's a young, very exciting and very knowledgeable individual who is now pushing to help us with USA to summit. Was created just a couple of years ago during the heart of the pandemic when I had traveled to West Africa and went through Benin and came back. At that time, 1 or 2 people were wearing masks. And when I arrived, one of the folks that I met, a former colleague of mine, called me and said, wow, you know, this COVID-19 is hurting. But, you know, there's a doctor here who has something that works. I said, you tell me what it is. I didn't take 2 days.
Mr. Sarr, I'm sorry, I don't mean to cut you off, but I told our viewers that, you know, yes, the youth is obviously in you, but you are a heavyweight champion. Let's go to Travis to introduce himself, because we'll come back to that when we're defining, you know, we're talking about the background of APIVIRINE, what it's all about. So, ladies and gentlemen, let me introduce you, or let him introduce himself, and that is Travis Kendrick.
Thank you very much. So yes, I'm Travis Kendrick. I serve as Vice President of Wayne Pharmaceuticals. Wayne Pharmaceuticals is the only Black manufacturing pharmaceutical company in the U.S. So we're proud of that designation. And we were originally approached by Michael and his team at APIVIRINE and ApiQuest to help them with their clinical trials. And I was so excited to have the opportunity to hear about APIVIRINE and its promise as far as it goes to the COVID virus and what have you. And what was great about it is because during this time, as we know, Black Americans were hit the hardest with COVID. We had the highest level or morbidity diseases such as high blood pressure and diabetes, which COVID ravaged. So it hit our community so hard. And it was such an exciting opportunity to work with the ApiQuest and APIVIRINE team to bring a natural product to market. And the reason it's important is because in our communities, a lot of our people in our community thought that the vaccine was something that was going to be detrimental to their health. And so a lot of them stayed away from that and did not take the vaccine. And matter of fact, at Wayne Pharmaceuticals, we actually did the vaccination program. And I encountered this among many of the community that they did not want to take the vaccine. And, they say, well, we don't know. It hasn't been out long enough. They just seem like they just created this too fast. And as a result, a lot of elderly people in our community, a lot of sick people in our community actually passed. And it was such a heart-wrenching thing to see people that, refuse to take the vaccine because they didn't believe in it. And so it was such an exciting opportunity to work with the ApiQuest and APIVIRINE and Mike and the team. And so at Wayne Pharmaceuticals, what we did is I started working with them as a consulting role and helping them get this product to market. And that's my role, and that's what I serve as to try to facilitate and bring this product to market in the U.S. and around the world.
Wonderful, wonderful, Travis. Wonderful, Dansar, Mike, sorry. Ladies and gentlemen, this is going to be really fun. It's going to be interactive. I will just throw in just a small question, and then there will be you'll see them chewing it up and explaining things to you. That's what it's all about. It's not just about our communities, the Black communities across the globe. It's about everybody. It's about humanity. After all, Africa, the cradle of humanity. Tell me, either of you, what really is APIVIRINE? Am I pronouncing it right? What is it? Just go for it, and I'll just lay back and listen, just like our viewers. And they might be calling in and asking you questions. Go ahead, folks.
Wonderful. If you may, APIVIRINE is a wonderful, wonderful supplement that actually and scientifically shows that when you use it, you boost your immune system, period. And any kind of viruses don't like that. They don't like things like APIVIRINE. APIVIRINE is natural. It's a natural product that derived from a plant called Dichrostachys glomerata. It is the scientific name of it. And we invite anyone to Google that name, and you would see what APIVIRINE can do. It is natural. And Dr. Agon, in his scientific mind, thought about it. I know he appeared on your show not long ago and explained even more. But we are proud to say that this young doctor brought to the world from Africa what is to be and will continue to be a solution to helping our communities, helping America, helping Africa, helping the whole world to be healthier and to be able to contribute to our economies wherever we are. Coming from Africa, it's huge for us. So APIVIRINE does that. And APIVIRINE was not just a baby from yesterday. Dr. Agon had APIVIRINE over 20 years ago, but for another purpose. It served for helping with HIV/AIDS patients. And that's, again, that's a virus. And coming from there and looking at what happened in the 2020s with the pandemic, he realized, well, I can do something about this. He looked into his arsenal of APIVIRINE and he tweaked it and created something special that really made or became a game changer. I will yield to Travis to bring his opinion, if you don't mind, Doctor, and then sure. we can answer any other questions.
Sure, the ball is in your court.
Yes. So Mike explained APIVIRINE pretty well, and actually, Dr. Gunn actually gets even more credit because in his scientific discoveries, he's actually able to extract the methanol out of the leaf of the APIVIRINE plant and create the product from that. So, and I think that's a patented solution that he has. So it's not only that, and we're actually working on trying to get to the point where we can synthesize the product and make it more available to in higher abundance. Right now, it's very intensive work to extract this product and bring it to market. We would like to make that so we can. Right now, the cost for extraction is fairly high, which is why our product actually is a little bit on the high end. But we're trying to get that cost down so that we can provide the product at a cheaper price to people around the world. You know, everybody can't afford to spend $50, $30, $60, $70 for a product, even though this product can save your life. But you know, until you actually get COVID, you don't realize the value of this product. And so we try to tell people it's important to take APIVIRINE on a daily basis to keep your immunity up. So you take one pill a day. Natural product, it dissolves, blah, 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 but it keeps your immune system boosted so that if you encounter COVID or any other viruses, that your body is boosted enough to hopefully help you fight it off. And so that's our goal, is to bring this product down in cost and make it more available to everyone.
Yeah, that's wonderful. You know, our communities, you know, they were rightfully reluctant, you know, in believing in all of this, and some of our people still believe it's a host. Maybe at the highest level, even of the state and across the globe, they think COVID is not true. It was invented by politicians, and nothing came from China, so on and so forth. But you understand why our people are so reticent. You know, just a few pages back in our history, what happened? You know, we were used so mischievously as guinea pigs without our permission, and you know what happened. So, in French we say, "Chat échaudé craint l'eau froide." See, you fall into that trap one time, and the second time you don't want it to happen a third time, right? But you are our folks. You come from our culture. You know who we are. You understand our soul. So we trust you. Why should we trust you?
Wonderful. Science is universal.
Good.
When you discover a scientific event or a scientific discovery, whether you are in Africa, in Europe, or in the United States, that remains true. And that's the basis of the credibility of APIVIRINE. First of all, it's a plant.
Yes.
It's natural. And when we recommend APIVIRINE, it's like we asking you to consume any kind of vegetable like or a fruit that you may take to calm down your cold or you know, and this is the type of thing APIVIRINE is. It is natural, and the scientific work that's been done in Burkina Faso was exceptional, and it continues to be so, as Travis said. But if I said to you, get some broccoli and it will help you with such and such issue that you're going through, you're not going to see a doctor for that. You just consume it because it's food. That's what APIVIRINE is. But because we know there is such stigma, and because we know, especially anything coming from places like Africa today, any discovery, however it is, we then go to the science. And so we have the scientific proof. And we continue to do even more to make sure that we can get even more from APIVIRINE than what we say it is today. So we have, as we speak, contacted some university here in the United States to further look into the product and see what they can find, what molecules are actually the active ones that are making it so difficult for viruses to disappear when an individual consumes APIVIRINE. So we open. Actually, this is the best challenge we have now. Anybody from your viewers, or any doctors, any researchers that want to meet that challenge, we welcome them very much so today. Just like our president said the other day, I'm not going to politics, but he mentioned, look, if you want to touch this, hey, I'm going to be your nightmare. We welcome any researcher to come and challenge APIVIRINE as it is today in terms of what it does. We have anecdotals all over the United States, all over Europe, all over Africa.
Wonderful.
And one of the things we also did was back in October, we were invited by the government of Burkina Faso, where the studies originated for APIVIRINE as a supplement against COVID. And most of the government officials knew about it, of course, have been using it and knew exactly the powerful effect of APIVIRINE, how much life it saved, how much they felt comfortable. And yours truly, we traveled during the pandemic. I personally did. And it was fun to be sitting and feeling good. Mind you, we got vaccinated. I got boosted twice. However, I like my APIVIRINE because it makes me feel I have not had a cold since the pandemic.
Wow. Wow.
And when you sneeze and you take one APIVIRINE pill, the next hour you go about what you have to do. And this is anecdotal, but we want the science to come. And so we're pushing harder because Africa has to actually assert itself as a place for research, as a place for discoveries. Doctor, you know very well, Africa is the place of discoveries, and we need to cement that. We are proud of this product, and no one can come around and deceive that otherwise. We know what it is, and we're ready to show any scientific proof of APIVIRINE. But for now, we're asking people to consume it as a supplement, because like broccoli, and you save yourself. We know COVID is not gone. The US, the government had just said they're not going to continue to support folks on that. The emergency is going to be over. But the World Health, CDC, NIH will tell you, continue to take measures against this virus.
Right.
And APIVIRINE is one tool in the toolbox that we bring to the table for the US government, for anybody to look at, for the whole world to consume and feel healthy.
Wonderful, wonderful, Mike. That's so well said. I'm coming to you, Travis, but let me just invite our viewers. You see on the screen, you see those numbers. You start calling. It's about time you call. It's about time you dial in and ask this gentleman tough questions, because we are all law-abiding citizens in this country. And that's who we are, and we trust everybody, no matter where they are, to be law-abiding citizens of the world, of the globe, because the health is just not an American issue. It's not just an African issue. It's a global issue, and it's a pandemic. It cut across borders, those artificial boundaries that we put in place, man-made boundaries. Viruses don't know boundaries. They're artificial, right? But tell me, There, help me, Kendrick, Mr. Kendrick, Travis, deconstruct this myth. Is it a myth or is it reality? Help us deconstruct this, because in America here we say, oh, big pharmaceutical companies and doctors, that condone a connive, and then, that's what they do. But now, Mike just said something. It's a challenge. It's challenging scientists all over America, all over the world. Come to us. Take APIVIRINE. Take it to your labs and prove us wrong. That's the challenge. That is the challenge. And also, what is interesting, Travis, it is FDA approved. What is FDA in America? And how important is it for a product to be FDA approved? Travis?
Yeah, definitely. So I appreciate that. Well, working at Wayne Pharmaceuticals, obviously our focus is on bringing healthy products, natural products to market. That actually was our focus. So it was great having the APIVIRINE and ApiQuest team contact us to try to get their product approved through the FDA. What we find out is that it takes millions and millions of dollars to get stuff approved through the FDA, right? So the people that can really do that are the people that already have the means to do it. And so,
what is FDA? So
sure,
that the others
may know. Sure, the FDA is the Federal Drug Administration. There's the ones that, in order for you to sell a product and make a claim on a product, meaning that, okay, this product kills COVID. In order for them to make that claim, you can't make that claim without FDA approval, meaning that your product has been tried and tested and approved by the FDA. So we don't say APIVIRINE kills anything. We say APIVIRINE boosts the immune system so it helps your body fight off, because we can't make that claim because we're not an FDA approved product. But that doesn't mean the product is not helpful. And so what you'll find out is that products like APIVIRINE and other natural products, they work for what we need them for. And we find out anecdotally, like Mike said, I've been taking APIVIRINE for the last year, and I take one a day as a preventative. And I've been in situations where I've been in the crowds of a lot of people at conventions. And I came back home. I'll tell you the situation. I came back home and I went over to my aunt's house for dinner. And I was curious to see, well, before I went over there, I tested myself to make sure I did not have COVID. And so I went to her house for dinner, Sunday dinner, and she calls me over like Tuesday. She calls me and says, "Hey, I have COVID." I say, "Really?" I say, "Wow." She went to a funeral with her, and she caught it there with some other people. And I went and tested myself again about a couple of days later, and I was still negative. So I took her a bottle of APIVIRINE, and I said, "Hey, just try this." She's like, "What is it?" I said, "Well, it's something that's natural, and I believe it will help you with getting over your illness." And now she's been tested. She's taken all the tests, the boosters, all the vaccines, and what have you. And so, but she's still, caught COVID, which can happen. And so I took the bottle to her. In about 4 days, she called me. I said, "Well, call me about 4 days." And she was negative in 4 days of COVID after getting diagnosed on Tuesday. So that's anecdotal. FDA doesn't approve that because that's not something that's scientific. But what I'm saying is APIVIRINE is something that everyone should have in their medicine cabinet, just like you have vitamins, right? You have vitamins to help your body fight off diseases. And that's what we use APIVIRINE for, is to help our bodies fight off viruses and other things like that. So that's it. Mm-hmm.
Also, to add to what Travis just said, Dicotyledonous glomerulator is a plant that's grown here in the United States, that's already recognized by FDA as a plant that you can consume. So we did get expert advice before we put it to market as such. So we are 100% saying that this product can be consumed in the United States. And again, FDA approval comes with any scientific testing that you would do, which we continue to do for APIVIRINE. So at some point, APIVIRINE will be proven to be not only just naturally a product that can help you with your immune system, we can claim that it also actually kills the virus, but now it does what it does. You take it, you feel good. You must have it in your cabinet to protect yourself, to boost your immune system, and that's against multiple viruses.
Okay, taking APIVIRINE as a supplemental, something you must have. It's a must-have supplemental in your medicine cabinet, says Travis, and also supported by the anecdotes and all those beautiful, wonderful anecdotes narrated by these two gentlemen. Ladies and gentlemen, you are on Tempo Africa TV on this great show. Kefel Africa, what's up for Africa? Any questions? Feel free to call in. Ask Travis, ask Mike. They have answers for you.
Yes.
Gentlemen, tell us, walk us through the role you're playing. You've already said a little bit about that, but just some more details. What role are you playing or have you played in the process of, from research to production and clinical trials down to the sales of this supplemental medicine? Go ahead, go for it. What role are you playing or have you played?
I think Travis touched base on his, and he will come back to that. And when it comes to APIVIRINE in the United States, first of all, we brought it to the market in the United States after we realized that our people, the United States, the whole world was losing so many souls on a daily basis.
Yeah.
And those that had a chance to connect with us can tell you more about how they felt, how they feel about themselves today, and how thankful they are to have gotten APIVIRINE to help them go through their situations. Secondly, we are focusing on the research part. We have had some few phases, every medical. We're not doctors. We're just asking you, exposing what is being done. We have our doctors who may come to the show at a certain point and go deep into what aspects have to be addressed later on. However, on educational standpoint, we are looking into connecting the research center in Burkina Faso, the medical doctors, and every participant in the research that brought APIVIRINE to market to connect with American universities. We're targeting HBCUs. We already contacted some of them. Actually, even during the pandemic, they were willing to do something. However, at that time, the giants were around. The Pfizers and the Modernas were already within those universities to do their own clinical research. With, of course, millions and millions and millions of dollars given to those universities to do so. We were looking for help, and it was different. They told us our clinicians are out, a lot of labs were closed. And so the few technicians that were there were not available to come to our aid. However, this commitment is still there. And we want to go to that level where the scientific part would be openly out to the market so that doctors can prescribe APIVIRINE as a remedy to some of the ills that we mainly anything coming from viruses. But right now, we are content and very, very happy where we are in terms of how people are happy to consume APIVIRINE and the results that they get. I constantly get calls from our people who are repeat buyers of APIVIRINE and how good they feel, how better they feel, how much it helped them when they go to crowds or when they traveled and they don't need to worry anymore. And so that's mainly what we're doing, but we want to mainly bring the aspect of an African research product to be also known in the United States and the world that this product is valid, that the research done in Burkina Faso and the papers that are being now published here and there in Greece, in other parts of Europe, are also part of that research. We want to bring that scientific research to the United States to continue to build on it, because Africa is participating in the global research to bring in anything we can bring in to stop the virus. We know it's not over yet. We know others are coming soon. So we want the researchers, universities, government to know that Africa can also be a solution to a global crisis. And this is one of the roles we play and we want to continue to play as APIVIRINE and ApiQuest.
Yeah, this is no coincidence that this is the month of the Black History, Black History Month, and we're talking about Africa, the genesis, and what Africa is contributing to the world in terms of, you know, health products, ideas, the science. Travis, what do you have to add to what Dan Sarah has already said?
Well, definitely, I think the Africa and the African continent is the cradle of civilization, and I think it's also the cradle of the things that are going to heal our world. Which is what interesting. The plant that we have for APIVIRINE, the plant that we use to create APIVIRINE from, that plant is actually edible. So the fruit of that plant is edible. So every part of the plant is edible except for maybe the roots, but they can probably make soup into that. So the fruit of that plant is called the spice fruit, and that's used to make mopa, I believe, in several African countries, and it's ground into a powdery substance, and it's used to make soups and stuff like that. And so I found this article. Apparently, there's a lady from Switzerland that went to West Africa and discovered this fruit, and found out that it actually is a weight loss dietary fruit product actually also. So it helps with losing weight. So she was able to take that and put it into a pill form and create and sell it as a dietary product. So we know the value of the plant that we have, and we know the power of that plant. So it's also I think that the African people and the African continent needs to understand that all around them there's things that the world needs to know about, and these home remedies that they've been creating, believe it or not, those things could probably be synthesized into a global product. So we're just happy that Dr. Agon brought this product to market, and that we are able to now take that product and let the American people know about it, and also the world know about it.
Wonderful, wonderful. It's so interesting that you're giving those beautiful examples. And Mike, yeah, talking about HBCUs in the United States, all universities, as a matter of fact, South Africa, Nigeria, Europe, you name it. You know, this is Black History Month, and HBCUs, go for it, go for it. And I'll be receiving in a couple of weeks, I'll be receiving the president of Norfolk State University. What a wonderful lady. You'll hear from her. So don't hesitate to go and talk to Norfolk State, all the HBCU, all the predominantly white institutions, because it's not black and white and green and yellow. It's about our health. And this is a supplemental product. Beautiful. Ladies and gentlemen, you are on Tempo Africa TV on the great show, Kafel Africa, What's Up Africa. Your questions, if any, but if so far these are great pedagogues, you may not have questions for them because they've explained things so clearly. But hey, they will leave a number by the end of this show. You can call them how to get to APIVIRINE and have your own doses, okay, and supplies on a regular basis, either directly or through Tempo Africa TV and Tempo Africa TV viewers. You might have discount. I'm not making any promise, but hey, Mike and Travis, we are here to serve our people, to serve our communities. And our people, our communities, it's not just the blacks, it's not just the white, it's the global community. That's what it's all about, right? Now, I'll be interested in hearing some more facts from not just from Africa, but also from Europe, from Canada, the rest of it. You started talking about that. Give us facts that support the title of our show today. Science is universal. Do we have facts? Even Africans can come up with supplements like APIVIRINE. Do we have facts to support that? That science actually cuts across, the color of skin and ethnicities and all the rest of it.
We do, absolutely, because right now, Dr. Agon has at least 70 products of such category as APIVIRINE that are being now also evaluated, and we want to bring to market at a certain point. We just came back from Vancouver, where there was a summit just less than a month ago.
Vancouver in Canada.
Yes.
Okay.
In Canada, and our plants, our plant-based solutions to our health. The Canadian government, aided by some of our partners here, who are affiliates of plant-based science issues here in the United States, the Canadian government is looking deeply into the particular subject we're talking about today. How can plants, as natural element, help the human being's body? This is where Africa comes in very, very, very well. So in terms of discoveries, in terms of plants, in terms of anything we produce, from plant to technology. As I said, I have traveled extensively on the continent, and I see a vibrant youth that has things that cannot be seen within the Western world, just because of lack of communications, lack of connections that need to be done. I've watched some of your shows where you brilliantly showed that African knowledge has to be shared here and there. It had to be acknowledged. And being the cradle of humanity, we have a lot to offer, and we must be very conscious about that. It shows when you mention the African youth here in the United States, or parents of African descent who see the children evolve here, you see the difference. The synergy with African Americans is creating a total network that is vibrant, and that is serving the cause of education here in the United States. You see that in sports. You see that in many things. And I remember one of your viewers or hosts has mentioned something that I always talked about, but a different way. When you look at African athletes, especially those who play soccer, and today basketball, they improve when they leave the continent and bring their qualities to Europe or to the United States. And some of them go back to the continent and contribute within their national teams. This is, we can call it anecdotal, but this is reality.
Yeah.
You see a young man taken from his village or her village. Mane is one of them that comes to mind to me, the Senegalese superstar.
Yeah.
He never went to college, but today his name is bringing Senegal to a level where any professor cannot do, because he was able to live out, come branching, and use that knowledge to bring his country to, look, I'm African, but look what I can do for the viewers of soccer.
Wow.
You see them in Togo, you see them in Burkina Faso, Mali. South Africa. Even today, you saw Morocco. Yes, they're part of Africa too, who show some stuff. We have to be conscious of that. And this mission that we're embarking with Dr. Agon is one of those. And we know we're going to be successful because this is science.
Yeah.
We know it is successful. I'll repeat that because this is science. APIVIRINE is science. So we feel comfortable in our skin to talk about it. And we invite anybody, US government, African government, to pay attention to discoveries that Africans start having, so we can globalize those discoveries to make Africa really the cradle of humanity it is. We have a lot of work to do, but it's very, very promising.
Wonderful. Wonderful. Thank you so much, Mike. Okay. Oh, there's a call. Okay, caller, please, you have the mic.
Thank you, Professor. I don't know if you can hear me.
Definitely, I can.
Yes, this is Mr. Nyawa. I'm just calling from USA. I've been watching this show, and I have a main concern today. They talk about approval for FDA. I hear that. And you know, this medicine has been made by African. And we know how this medicine can be powerful. But my concern is if we want to bring this medicine to USA, I don't know if FDA will approve it because there's too many challenges, too many fighting. They have already the medicine they want to sell. And this medicine came from African who are made in. It's a very, very powerful. Are they going to accept it? If they accept it, where the money going to go? If they accept it, how they going to, I don't know, how they going to benefit, you know, from this product? The same question, you know, I can address about also what's going on in Europe. If you got to bring the medicine in Europe, how are they going to be? Because they need to approve it. Among the African, we can accept it. Anybody can call to take, to get his medicine. But on international, you know, spot, how you guys can deal for this medicine to be approved by all these people, because there's many fighting on challenges. This is, you know, my worry, my concern for today.
Thank you so much for calling, caller. Thank you so much. I think the young man here will give you the answer. They've already answered that question. Maybe they will repeat it again. They will repeat this. I'm not answering for them, but it's like green pepper. It's like broccoli. This is not medicine to cure anything. They say supplemental, like the vitamins, something that will boost your immune system. I'm not a doctor. I'm no part of the pharmaceutical industry, but hey, Travis,
the virus,
give it a shot. Yes, caller, we've heard you. They're now about to answer your question.
Brought in United States.
Yes, they are going to answer your question, caller.
This is my concern. And
yes, caller, they will answer your question.
France, the same question.
Yes, caller, we heard that. They're going to answer your question. Okay, Travis, what do you say?
Sure. So I would answer that question and say that right now, currently, APIVIRINE is actually manufactured in the U.S. So this is actually a U.S. product.
There you go.
And so it's already in the market and is already sold in the U.S. So as far as the FDA is concerned, obviously it takes a lot of money, time, and effort to actually get stuff approved for the FDA. But guess what? We don't have to wait for the FDA to approve it because right now it's already available for sale as a natural product supplement. So it does not need FDA approval to be sold and be available now for you or around the world, even in Europe. And so that's where Dr. Agon wanted to make sure that this product's available without us having to take 5 or 10 years of research and millions of dollars to get it to market, because people need this product now. They don't need to wait for help. And so that's why I think that the FDA, yeah, they may take a while to do it, but we don't need them because we're already in the marketplace.
Thank you. Beautiful. I hope caller heard that. What do you say, Mike?
Exactly 100%. Some products don't need FDA approval to be sold. As we said, this product is a natural, think broccoli. You're eating broccoli. That's why we're selling to you and telling you this can help boost your immune system and protect you against viruses. We also got some FDA input. We ask questions. We're very careful about what we do. And that's why we're so confident about what we bring to the market here. Every single aspect is followed through. That's why in the beginning of the show, we mentioned that this is a plant that's also recognizable and found here in the United States, and the FDA knows about this plant and knows that this is a plant that one can consume and be healthy. The plant, you can find it in India. As Travis said, this is what people consume in certain countries like Cameroon. A lot of it is consumed as soup, as just soup. They make soup out of it for many other reasons.
Yeah.
And so we're confident. So I think the question was good. I like the question to help us even clarify what we're doing. The FDA approval is not necessary for a product that's a supplement. Just want to make sure that this product is clean, is non-toxic, which is already there. We made sure labs here in the United States have verified that. And so, as Travis said, APIVIRINE is now made in the United States as a supplement. And we challenge everyone, and we invite everyone, quite frankly, to have that bottle in the cabinet just for days to come, because these viruses with the variants are going to be with us for good.
Yeah.
So
that definitely. Yes. Go ahead, Travis.
Yes, and I'd like to add something to that also about the FDA thing. So the reason that products are approved by the FDA and people want the approval is for it to be prescribed by a doctor for disease. That's the value in having the FDA approve a product. And ultimately, like I said, our goal is to get there. But with Michael's research, what Michael did when he went to Vancouver, he met with some officials there, and he met with some scientists there. They're actually working on trying to design a way using the blockchain to actually get supplements being able to be prescribed by doctors, so that you know the source of the product, you know the value of the product, you know that product, and then through that blockchain technology, which Mike can probably explain if he gets into it, but to actually have supplements be able to be prescribed. And another way you can get a supplement prescribed without going through the FDA, which is to do a, I forgot, it's like a test of a bunch of individuals, and getting a patent for that and actually getting the product out that way too. So there's other ways to get the product approved and have doctors prescribe it. But we definitely value the FDA's just as an organization to make sure that the products that are on the market, that are prescribed, do what they say they're going to do. So we definitely value that.
Wonderful. And let me remind all of us again, this is a Black History Month, but this is not a black and white issue. It's just our humanity. It is a global issue. Health is a global issue. This is very critical, and we need to understand that. So the world is shrinking. It's really coming together is coming together, not just because of health issues, but economic issues as well, and all the rest of it. You see, it's like Gary is available all over America and Europe now, and cassava flour and the fufu from Ghana. It's all over the place. So those fruits that we really love, and you need something just to chew on and to take for you to get over the obesity. To lose weight from eating. You just eating McDonald's. This is not propaganda against McDonald's, but we want to eat healthy anyway. You see, it's all over the place. Palm oil from Africa, from Ghana, from Burkina Faso. That's just the reality. Palm tree are planted everywhere. A chewing steak, with the virtue of it. Beyond cleaning your teeth, there is something deep inside. That's what this is all about. And I'm not helping you do your marketing. You got to pay me for doing that. Pay Tempo Africa TV. But ladies and gentlemen, the time is running out. What's your concluding statement? Yeah, go for it, Mike.
Thank you, Dr. Balubi. First, we want to thank Tempo Africa for this tremendous job that's being done to serve African communities, American communities, and to promote the connection between Africa and the United States. I think this is vital for the development of Africa. I also want to thank you for inviting APIVIRINE and ApiQuest to this show that I love because it brings in a lot of insight of things around Africa and here. And it also allows to improve relationship among humans, which we need today. And it allows Africans to come to a forum where they can discuss further what they need to do to keep this continent together and start focusing on development as opposed to political strifes. And that is laudable. I want, on behalf of Dr. Agon and on behalf of our team, our very, very hardworking team behind Travis and myself that bring APIVIRINE to market, to thank you again for allowing us to say a few words about APIVIRINE. We want to reiterate that APIVIRINE is a plant-based immune system booster that we recommend you have. You will not regret it. You will not regret it because you will feel comfortable. You will help yourself. You will help your community, black or white. And this, on this Black History Month, we want to say that Africa is bringing to the world something new, something great that we all need to applaud and consume to keep on living and to keep on doing what we need to do to bring our people together and stronger. And thank you again.
Wonderful. We're pleased. We will be missing out on something very big if we didn't see that bottle of APIVIRINE. If you have it handy, please, Travis, go for it and make your concluding statement.
Thank you, Dr. Balu. Appreciate it. So this is APIVIRINE. I think everybody can hopefully see that well in my camera. So this is, there's 30 capsules in this bottle. What we would like to do is offer you guys a 20% off on the APIVIRINE. If you go to the website and you put the APIVIRINE in your shopping cart, you can use the promo code TEMPO20, TEMPO 20, and that will give you 20% off the bottle, any amount that you will purchase. And so we would like to encourage you that coupon is available for another month. I think it expires on March the 17th. So you have some time to get it, but we'd like to invite you definitely to get the APIVIRINE and purchase it and put it in your shopping cart. And like I said, the promo code is TEMPO, TEMPO 20. and that'll give you 20% off the bottle. And we'd also like to encourage you guys to, if you have any questions, you can email us at info@apivirine.com. That's info@APIVIRINE.com. And we'll be happy to provide you guys a one sheet which lays out the product and some details about the product that we can send you a PDF of that. So if you have any more questions, you can follow up there. Okay? Thank you.
Thank you very much. And let me give this number as well, because the Tempo didn't happen by accident. Tempo Afrique TV, the Pan-African television by Africans for all Africans. And HBCU and PWI, you are ready to take the challenge. Take this to your labs. This is food for thought. Let's chew it. Let's munch it together. And the number is the +1 612 804 0295. +1 612 804 0295. And then you'll be talking directly to our producer, the CEO of Tempo Afrique TV, because if you didn't remember what to do to reach out to these guys and do what you got to do, the Tempo coupon is there for you. Call this number, and before you know it, the miracle is happening. Ladies and gentlemen, thank you very much for watching this wonderful show. This is a unique show. It happens once in a blue moon, but you know what? There's so many people out there, so many great people doing great things out there. And this is Black History Month. If you're doing something to make a contribution, to make a difference, not just in the lives of people of African descent, the people of Africa, on the continental Africa, but across the globe, across everywhere, for humanity. If you're doing something like that, call us, call that number, and then we'll be more than happy to give you prime time here to promote what you're doing for humanities. Thank you for coming to our show, Travis Kendrick. Thank you so much.
Thank you.
Thank you also, Mike Sar Densar.
Thank you.
May God bless both of you. May God bless Africa. And thank you, a big thank you to our producer, Malik Sar, without whom we couldn't have done anything. We wouldn't have been able to see Densar. We wouldn't have been able to see him. We could have heard his voice, but here he is. You know, the youth in him, the youth in Travis, they're heavyweight champions.
Thank you.
Ladies and gentlemen, that's all we got time for today. Goodbye and be blessed.
Thank you.
Bye.
Du nouveau à Minneapolis, Tempo Afrique Travel. Vous voulez voyager? Achetez vos billets d'avion à l'agent de voyage Tempo Afrique Travel. Avec l'agent de voyage Tempo Afrique Travel, pas de problème de connexion, pas de problème de transfert de vol. Avec l'agent de voyage Tempo Afrique Travel, c'est le voyage en toute tranquillité, en toute beauté, de votre maison jusqu'à votre destination. Votre satisfaction est notre plaisir.
Votre attention s'il vous plaît. IPTV Services. Tempo Afrique TV vous offre 6000 chaînes de télévision en direct de l'Afrique, de l'Europe et des États-Unis. Toutes vos chaînes de télévision préférées sous un seul toit. Pour des informations, appelez le numéro suivant +1 612 804 02 95 ou allez sur notre site web tempoafrique.com. Achetez maintenant $193 pour toute l'année, plus l'expédition et le TV Box.